This product, called Evusheld, is approved in Canada to prevent or treat COVID-19. It contains antibodies called tixagevimab and cilgavimab that can neutralize the coronavirus and may help prevent or treat COVID-19. If you are considering using this product to prevent COVID-19, make sure to speak with your doctor first, especially if you have recently been exposed to someone infected with COVID-19. Your doctor can provide you with more information about the risks and benefits of treatment with tixagevimab and cilgavimab. If you are enrolled in a study, your doctor should provide you with more information through the informed consent form. If you want to learn more about tixagevimab and cilgavimab, ask your healthcare professional for the patient information sheet. This medication is administered by a healthcare professional through an injection into a muscle. It is given as a series of 2 injections, with each injection being administered in a different area of the body. After the injections, a healthcare professional will monitor you for at least 1 hour to watch for any serious side effects. If you are using this medication to prevent COVID-19, you may be given another dose of tixagevimab and cilgavimab at a later time for continued protection. Be sure to consult your healthcare professional for more information about this. If you experience pain, soreness, swelling, or bruising at the injection site, it's important to let your healthcare professional know right away. Rare reports of heart problems have been linked to Evusheld, especially in people with a history of heart disease, heart attack, stroke, or other risk factors for heart disease. If you experience symptoms such as chest pain, shortness of breath, unusual sweating, swelling ankles/feet, unusual tiredness, or fast/irregular heartbeat, seek medical help immediately. While serious allergic reactions to this drug are rare, it's important to seek medical help if you experience symptoms such as rash, itching/swelling of the face/tongue/throat, severe dizziness, or trouble breathing. The full extent of potential side effects of tixagevimab and cilgavimab is not yet known, so it's important to discuss any concerns with your doctor. Before starting Evusheld, make sure to inform your doctor about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. There is limited information about how Evusheld may interact with other medical conditions or medications. It's important to discuss your medical history with your doctor before using this medication. If you are pregnant or think you may be pregnant, talk to your doctor before using Evusheld. The benefits and risks of using this medication during pregnancy should be carefully considered. It is not known whether Evusheld passes into breast milk, so it's important to consult with your doctor before using this medication if you are breastfeeding. It's important to be aware that tixagevimab and cilgavimab may have interactions with other medications, which could affect how they work or increase the risk of serious side effects. Currently, there is limited information about potential drug interactions with these drugs. To ensure your safety, it's recommended to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that you are taking Evusheld, EUA, 150 mg/1.5 ml, 150 ml intramuscular solution Sars-Cov-2 antibodies, tixagevimab, cilgavimab safely and effectively. Currently, there is no information available about the effects of an overdose of Evusheld. If you have any concerns about the dosage of this medication, it is important to consult with your healthcare provider for guidance. Introducing Evusheld, an intramuscular solution that contains Sars-Cov-2 antibodies tixagevimab and cilgavimab. This medication is used for the prevention of SARS-CoV-2 infection in individuals who are at high risk for severe disease. The recommended dose is 150 mg per 1.5 ml given as a single intramuscular injection. It is important to take this medication as prescribed by your healthcare provider. The optimal timing for taking this medication will be determined by your healthcare provider based on your individual circumstances. Introducing Evusheld, an intramuscular solution that contains Sars-Cov-2 antibodies tixagevimab and cilgavimab. This medication is used for the prevention of SARS-CoV-2 infection in individuals who are at high risk for severe disease. The recommended dose is 150 mg per 1.5 ml given as a single intramuscular injection. It is important to take this medication as prescribed by your healthcare provider. The optimal timing for taking this medication will be determined by your healthcare provider based on your individual circumstances. This medication is not intended for home storage. It should be administered by a healthcare professional in a clinical setting. There are no specific storage requirements for this product as it is not meant to be kept at home. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.